Many cardiologists treat heart failure, and many cardiologists do an excellent job at treating heart failure. One of the problems we see is that many patients with heart failure in the community never see a cardiologist. They're still seen by primary care doctors, and they might not get referred on. It's really, really important if you have heart failure to see a cardiologist, because it's important to have a thorough evaluation to determine the underlying causes. For patients who come here, in addition to getting all of those things that they would get with their local cardiologist, depending upon their problems, we sometimes have imaging modalities and diagnostic strategies that are not always commonly employed in every community practice that may help us get a better handle on the underlying cause. If there's a concern about genetic abnormalities, we have specialists in cardiomyopathy who can help us decipher the genetic underpinnings to this problem. And then for patients who develop refractory symptoms, who are not responding well to medications, then we have obviously the whole range of therapies available to us. But we will make sure that patients receive the appropriate guideline recommended and directed medical therapy very aggressively. We tend to be very, very aggressive in our approach. We tend to spend a lot of time with our patients to educate them as to the why of what we're doing. Sometimes patients are overwhelmed. They're prescribed a lot of medicines, and they say, well, I'm only going to take this, that, and the other thing, and their doctor, their local doctor, tells them what they should do, but it still doesn't sink in. Sometimes we are able to modify that behavior a little bit. Sometimes we're able to spend a little more time with them. And sometimes just hearing it a second time is helpful. One of the really fabulous things about working at Northwestern is that we are able to provide a comprehensive multidisciplinary approach to many, many problems. We have excellent specialists in the full complement of cardiovascular disease, which for a person like me who is an expert in heart failure, it's really nice to be able to refer people who are equally expert in the other areas, whether it be technical areas, interventional areas, surgical areas. We're also able to take care of highly complex patients. So there are patients who have cardiovascular disease and no other problems, but there are also patients who have cardiovascular disease and many other problems. And we're particularly capable of, because of my colleagues, I'm able to take care of those complex patients here. It's also a beautiful physical plant. It's a fantastic, provides the opportunity for a fantastic patient experience in the inpatient and outpatient areas. So it really makes it very fun to come to work. Also, as an academic medical center, I'm not just involved in the care of patients. I'm involved in the academic endeavor, and the research endeavor, and the discovery endeavor, and also in the education endeavor, teaching cardiologists of today how to take care of heart failure patients in their practice, or wherever they may be. So it's really that triad of clinical care, education, and research that sets us apart and makes it fun for me to come to work.